Hello, welcome to Monday Morning Matters live broadcast show brought to you by Magnicraft Consulting Team, anchored by Niyi Dunmade, a certified church consultant with the Society for Church Consulting in the U.S. Here, each Monday of every week, we address important, relevant, and actionable topics of interest that will help you and your church grow healthier. And now, meet your host, Niyi Dunmade.
Good morning, everyone. I just want to make sure that everyone is on board. Morning, everyone. Today is Monday Morning Matters. Good morning, everyone. It's a good time that I'm coming your way this morning. Thank you for allowing me to come to your space. Good morning to everyone. I don't know wherever you are in the face of the earth, but I bring greetings from the city of Abuja. A lot of things is happening in my country, but then let's pray that God brings His will to pass in our nation. But here we're going to talk more on church health, and then church health matters. Why church health matters? Church health is a combination function of a myriad of metric factors. Okay, so when you want to look at a church, there's quite a lot of metrics that you can look at in terms of what kind of systems you are trying to diagnose. Like when you are with a doctor in an hospital, there is a set of data for your nervous system, there is a set of data for your skeletal system, your digestive system, your circulatory system. Quite a lot of data are there for you to look at and see how you can improve. Okay, we are in a pandemic era this year, and COVID-19 has actually unraveled and brought about a lot of disruptions, exposed a lot of health issues in our churches, and because of the setback, we have to slowly, to take us on a slow place for us to recover back to health. But the earlier we start, the better for us as a church. The earlier we start, the better for us as a church. The Society for Church Consulting, for which I'm a member, I'm a certified church consultant, asked me to send a blog content, and I send that blog content, and it's really good, some good content there, titled Solutions to Major Gaps in Church Management. It's worth reading, it's thought-provoking. Some of the concepts is, do you really love and care about your church to the point of shifting mindsets, having some paradigm shift for the sake of closing these gaps that may exist or created by the pandemic? I'm going to just show you something in a good return. Now, this is where we are now. Okay, we need to find out exactly where we are now where we are now in terms of data. Okay, exactly where we are currently now, and then we need to understand the gaps, okay, and know the magnitude of change for us to move from now to the future. Okay, so that's what kind of mindset can you have for you to have that kind of growth? So current state now versus future states, how can we bridge that gap? Because if you do not bridge that gap will keep widening the more. That gap will keep widening, and the more it keeps widening, the more the problems will be. The more magnitude the problem will be. So now is the time for your church to get back to the path to health. Sometimes the churches with worst and unhealthy pasts can end up creating the best and healthy future. In fact, most of the people that have had some terrible church health issues are having a higher chance of getting towards health, because they know the pains, they know the disease conditions that may warrant them having that unhealthy state. Okay, so types of growth in a local church. Types of growth in a local church. Okay, we have conversion growth. Conversion growth is a growth that results from non-believers turning to Christ. So we need to have these facts on our table. What is our conversion growth? What is our transfer growth? Right now, because the pandemic has brought about a lot of shakings, a lot of disruptions, okay, there's going to be a lot of potting, a lot of moving from church to church. So this type of growth is a growth that results from church members moving their membership from one congregation to another. Okay, some churches are going to fold up, some churches are going to be distressed, some churches might just lose the hand on the steering, and because of that, some people want to just get themselves off the bus to another bus, and there's nothing you can do about it. Transfer growth is just going to be, but we should not leverage our growth on transferred growth. There's also biological growth. That's when church membership of attendance members are having children, babies. Okay, like in my church, averagely we have 50 to 60 babies a year. So if you have that in 5 years, that's 300 babies born in my church. In the next 15 years, that's a church on its own. That's a church size on its own. Then we have attendance growth, where there's an increase in attendance numbers from people who attend but do not join the church. So this is just something that we need to bridge that gap. Okay, most churches, their membership is way larger than their attendance, their frequently or average attendance. Okay, you can have a membership database of, let's say, 7,000, but the people who regularly attend your church maybe 1,000. You need to find out why those other people who are not coming frequently to your church are not coming, and then you try and reach out to them. So that's numerical and qualitative growth. Okay, and that happens from having some form of attractional pull from the community. We have expansion growth from increased numbers like small groups, multi-site, and micro churches. That's where the church is going to, where we have small churches, in the communities who are linked up to a major name or denomination. We have internal growth. Internal growth has to do with spiritual life, your discipleship level, your spiritual state, how you are growing from one glory to another, from strength to strength, from grace to grace. Extension growth has to do with church planting or church branching within a similar culture, where you go do some diagnosis of a community and you plant your church, put your DNA in that place. And lastly, the bridging growth, that it has to do with church planting across cultures. Okay, where you have your own culture and you want to move into another culture to preach the gospel and establish a church there. So we have different types of growth, and the truth about it is that the effect of transferred growth on your church, we need to understand what kind of growth do you have. What kind, is it a healthy growth? Is it a growth that you can say, yes, this is a growth that is good for my church? Okay, we need to move away from all those transfer growth and go into church planting, biological growth, conversion growth, and things like that. Can this kind of growth be termed real growth? Real church growth. We can't say it is church growth when Christians move from church to church, hopping from church to church. So be guided against growth misconceptions, and data will help you to understand the misconceptions of the kind of growth you have, so that you can understand how your church is growing. So I will show you something in a church life cycle, because the data you get when you are growing, when the church is born, is launching, is different from when the church is growing, is different from when the church is in a maintenance mode or in plateau mode, is different from when the church is declining or when the church is on life support or death. Okay, so they are all critical to data points and data collection point. Okay, so this church life cycle helps us to understand the quality of data we can get at different level or life cycle of the church, life cycles of the church. Now, one of the things I want to say here is, what is the data process initiation? We need to look at identifying the key performance indicators, collect and locate and collect data, and then 3, we have to analyze data and identify issues on what to do with the data. So, but then I would want to say here that there are more data points to consider from today's discourse. Okay, why we need a deeper set of metrics in ministry and church. Now we cannot rely on just counting monies or counting attendance. We have to go deeper to know what is happening. For example, one of those days as a church administrator in a church, we counting the attendance. Usually we try to find out those who are not in church. So attendance should not just a number of people who are present, but what are the stories and the number of people who are not coming to church regularly. So what is the manpower and the financial cost implication of getting one person saved? What is that resource you need to get one person saved, so that you count the cost, you are willing to pay the price, and you actually pay the price to get that person saved? What is the manpower, the financial cost or resources, the implication of getting one person discipled? Okay, because we don't know the cost, we do some form of half-baked establishment of people in our churches. So what is that manpower and resource needed to get one person discipled? How do we know that we are actually reaching the people we are supposed to reach? Every of our services, every Sundays, how to tell if your connection process is actually working and effective? Your assimilation process, do we have the front door so wide open and also the back door wider than the front door? Because that is just a sure way for your church to decline, and that's what a sure way for your church to go into death mode or life support or preservation mode. So how are growing churches doing more ministry with less staff? One of the things as a church consultant I try to help churches is that you can actually use less resources to get more. Okay, you can actually automate a lot of things. You can actually systemize a lot of things to get more done for your church. So how can your church also leverage on whatever it has to break barriers and stay healthy? Now, the attention and love for attendance numbers must just be off the table, because your church having a high number does not mean it is healthy. Attendance is just a byproduct of a healthy church. Okay, once the church is healthy, the byproduct is that the church is going to grow. And we are saying here that we want to talk on the things that will lead your church towards health. Okay, now one of the things I also want to explain here is, when I say we should not look at attendance, is this: we looked at lag measures. Lag measures are different from lead measures. Okay, and for you to be able to be on top of game, you must be able to combine lead measures or lead indicators and your lag measures and lag indicators. Okay, I'm a fan of telling people record everything. Okay, record, because you don't know what big data can be a trigger for your church growth. Imagine someone like serving a cup of tea in a church service double the church. You might say that, okay, preaching the word of God will make my church grow, but there's some things that can just make sure that people get the needed attention and the church is growing. So everything has a story attached to it. Have a system in place to record it, both the numbers and the stories. Numbers and the stories. We need both. We also need the lead measures, and we also need the lag measures. We should not always be focused on lag measures so that we are not reactive. We should be proactive by putting some lead measures, because when we look at the lead measures, we are going to make sure that we get the lag measures done. Okay, the lead measures are the data that helps you in the input of things, while the lag measures are what measures the outcomes. Okay, and there's nothing you can do about it. It just tells you the state of things. And then if you want to actually make a change, you have to go back to the lead measures. Okay, let's change our thinking about metrics and measurement. Okay, now one of the things I want to say, I've spoken with some pastors who say, I want my church to be just, because they are quality driven. All right, but we need to put a balance between quality and quantity. They don't want, I had some pastors who says, I don't want quantity, I just want some quality, and make sure that these people go to heaven. But you see, think about this. What do you really want? Do you want a small unhealthy church, or a large unhealthy church, or a small healthy church, or a large healthy church? Okay, those are three different things, and I know very well that the benchmark should be a small healthy church, and of course you should be able to desire for a large healthy church. So leading with lead and lag measure outcomes can be helpful, but you have to also look at the lead measures, no matter the size of your church, to attain health. So while a lag measure tells you if you have achieved the goal, it gives you some. If you want to monitor progress, lag measures is very, very helpful to look at the outcome. Okay, I'm getting the outcome I need to get. But then lead measures tells you that you are likely to achieve the goal. And when you look at the lead measures, it can also tell you that no, you cannot get your goal. So if you have a goal, to achieve something in 10 years, there are certain things you need to do from year 1, 2, 3, 4, 5. If by year 5 you are not getting some form of progress, you can tell yourself, forget the 10-year achievement. So, but then for you to get your achievements or your goals actualized, you need a combination of the lead measure and the lag measure together. So no matter where you are trying to achieve, your success will be based on these two kinds of measures or indicators, lag and lead. Once a team is clear about the lead measures, their views of goals will change, because they know that it's the input that will yield to the output. If you don't put something in, you cannot get something out. If you don't put some work in, you cannot get. So that if you don't invite your members, does not invite people, you can't have an increase in the number of first-timers in your church. So the lag measure you are measuring is the total number of first-timers that come to church. But can you look at the number of people who are actually inviting people to your church? Are you trying to look at the number of people you are empowering to invite people to church. All right, so that's just the next week I'm going to dig on this lead and lag measures, because there's so much to be shared. Lead and lag measures, I will look at that critically next Monday, and then we'll also look at types of analysis. Okay, types of analysis, where we have 4 stages of analysis. We have the descriptive analysis, we have the diagnostic analysis, we have the predictive analysis, we have the prescriptive analysis. What does all this analysis bring to the table? What kind of understanding, what kinds of call to action does all these things bring to us on the table? 4 stages of analysis, analytics, and then we're going to look at what are we going to get from all these things vis-a-vis the life cycle, the position your church is on the life cycle as a church. So much has been shared. I want to stay between 20 minutes. Next Monday, there's so much to be shared. I wish I can go on. In fact, there was a church that invited me, and so much was shared. The Money Matters is just for us to just scratch the surface. There's so much. I just want to share something that will set you thinking for the course of the week. So please go on my social media handle. There are quite a lot of videos and broadcasts I've done in the past. In fact, there's somebody that chatted me last week saying, wow, I never knew that there was something like this. I know it's new. I have a passion for churches. That's why I left chemical engineering to come to help churches with my expertise. I'm a certified church consultant. I would love to help you and make sure that churches don't close their doors in this time we are living in. So go on my social media handles. There are quite a lot of resources there, and if you do not see any resource that will help you, just private chat me. That if you not see anything, your page is not very interesting, I will engage you and I'll provide you something that you really want. Okay, so please, next Monday we're going to kick off from here on the stages of analytics, lead and lag measures, because the truth about it is that you as a senior pastor or a church worker, you need to understand some of these things, so that when we are talking data, we're taking decisions, we are charting the course of direction for the church, you understand the dynamics of what is going on, and then you are able to put your contribution to advancing your church forward. Okay, I want to wrap it up. Thank you for allowing me to come to your space. It delights my heart to always come every Monday to come share with you. Thank you for those who are sharing my brokers, who are private chatting me, who are sharing this content to their networks. I was so thrilled last week when someone just shared quite a lot of this stuff to his network. Thank you. I will want to come again next Monday with a continuation from where I stopped. I've done part 1, 2, and 3 of Why Church Health Matters. Please, if you have missed anyone, you need to go back, because by the time we now go deep down into the data, I might not have time to start explaining lead measure, lag measure, front door, the back door, and things like that, so that learning is cumulative. I've done part 1, 2, and 3. Let's get back and look at some of those things. And if you have any questions for me, please reach out to me on any of these social media handles. I'll be able to get you all the questions answered in no time. My response rate is very good, and I will respond quickly. All right, thank you for allowing me to come to your space. My name is Niyi Dunmade again. I'm the founder and the CEO of Magnicraft Consulting. Magnicraft Consulting is a firm that helps church grow healthier by empirical assessment and strategic blueprint. So when we come to help your church, we help you to direct your church towards the now to the future, bridging that gap, bridging that distance, to make sure that your goals, your aspirations, and your visions are actually actualized. Thank you. Till I see you again next Monday. God bless you. I sign out. Thank you.